Hi, welcome to Pathology Riddles. Today I'll be discussing 5 ways in which you can score much better marks than what you are scoring right now in your pathology theory exam. There are a lot of students who know less, but they present their answers so well that the examiner feels that they know a lot. While on the other hand, there are people who know much more, but they fail to present their answers well, and as a result, they get very less marks than what they should be getting. So let's start with the point number 1. Whenever you write an answer, you will be sure of few words in it. So underline those words because it will give more emphasis, and when the examiner is correcting very fast, their eyes fall on those words, and that gives a feeling that you know much more and you're very confident about your answer because you have underlined, and then you automatically score more. If you think from an examiner's point of view, they have a lot of papers to correct, so they can't read each word that you are writing. If you emphasize on certain words, and when they are the most pathognomonic of that particular answer, then you will get more marks. Point number 2. Whenever differences are asked, always try to write the corresponding difference on both the sides. For example, you are writing about microscopic feature, then write the microscopic feature of the other point. And if you are answering gross, then similarly on the other side. If it is example on the other side. Do not jumble up the differences. Point number 3. Always try to organize your answers in bullets. It makes the paper look much neater, because if you write essays, we may miss out on seeing something that might be important, or if you have written something, we may not read the whole essay. So if you want to show the examiner that you know, write it in bullets, make the paper look neat and organized. 4th, always try to answer the questions which have the least marks. Like for example, if your paper contains 2 marks or 3 marks questions, answer those in the beginning. Even if you have to write sequentially, go to the last pages and answer those, because they are the ones which can fetch you full marks. While the ones which have more marks, like 10-mark question or 15-mark question, you will not get full marks in those. You will have to write lots of pages, and still the examiner will not give you 15 on 15. So try to write the 2 marks and 3 marks first, so you know exactly how many you can expect in that particular section. And point number 5, whenever it's pathology, draw diagrams, draw flowcharts, and try to use different colors unless you are prohibited to use colors. Because in some centers, they scan and send the papers somewhere else for correction. And that time, if you draw in multiple colors, that print may not come exactly and it might look blank. So if that is not happening in your center, then use as many colors as possible, because we as pathologists love colors. And if you use multiple colors, we feel that you know a lot. So these are the 5 points in which if you use in your daily exams, you will be able to score much better, because we feel that you know a lot. I hope you liked this series, and if you did, please like and subscribe to this channel, and we will come with many more of such videos. This is Dr. Susan signing out until we meet in the next video.